Steve Flindall joins me now, emergency room doctor from Aurora, Ontario. Doctor, really appreciate you giving us your time.
Oh, I'm very happy to be here. Thank you.
Looking at the numbers here, how does it reflect on how you feel?
I completely understand this. Like when I heard the results of the survey, that's bang on with what my sense has been in the department for the last few years.
Mm-hmm. How have we gotten predominantly from bad to worse, would you say?
Yeah, it's been a really slow grind and like a real bleeding out of talented people.
Mm-hmm.
And as Dr. Perzada said on the lead in there, it's not the amount of work or the difficulty of the work; it's the hopelessness of the day-to-day outlook on where things are heading. I think one of the uh, starkest stats in this survey that came out was that 4/5 of workers didn't see a plan to make anything better in the hospital system. And I think that's the real attitude that is making people finally give up and leave.
It feels like a broken record when we always ask the question, so what needs to change? What more needs to be done? We know what needs to change and what more needs to be done. But from hearing it from your perspective, from what you're hearing from your colleagues, what you're seeing in the ERs there, why are we still here when we're seeing, as you say, people there isn't the motivation, they're feeling overworked, they're exhausted, both mentally and physically, and some are just feeling like they want to give up?
Well, it's been years now that the government has continued to praise nurses and healthcare workers and pay just lip service. But when the rubber meets the road, they're doing nothing to actively support us. I mean, you see the government spending, I don't know how many million of dollars trying to suppress workers' wages. That's been shown to be unconstitutional at least twice in court now. And they're willing to spend that money, but not money in the healthcare system. And then you hear on top of that, that based on their own budgeting, they're underspending on healthcare. I mean, it's the moral injury, and I forgive me for using the term because it's been overused, but it really is the moral injury of that situation, I think, is causing people to throw their hands up in the air.
How bad could it get then if we continue on this trajectory and there's a lot of talk but no action?
I mean, I feel like we're on a precipice here. Like you can't ask people to work nonstop in a situation where they feel hopeless. It's not viable. And we're really close there. Like so many people have left, and the government talks about how many new people it brought in. And as I said before, you can't count one new nurse as the same as a veteran nurse. It takes long hours and a lot of time for these people to get up to the level where they're truly competent and actually functioning in the like above average realm. It's not a one-for-one trade.
I've got one last quick question before I let you go, Doctor. They've talked about, the government, we know the province has talked about bringing more international doctors coming in, those looking to come into this country that have the expertise. Will that help?
Again, it will help, but you have to get everybody up to our accepted standards,
right,
and used to working in the system. I mean, I just went and worked in BC just over a year ago, and just the change in that, like the little subtle differences between the systems, it makes a big difference, and it really affects your efficiency. And even with the best of intentions, you can't work quite as well as you did in the system you're used to.
I think you nailed it right there. There is differences province to province, let alone country to country, and that's so critical when we're talking about healthcare and being able to meet patients' needs. Doctor, really appreciate you giving us your time, and we're going to say it as we said it. We continue to say it. We appreciate all the work that you and the doctors and nurses and healthcare workers in this country do, and we always thank you for your time. I want to wish you all the best for 2024, Doctor. Dr. Steve Flindall, emergency room doctor, speaking to us from Aurora, Ontario. Thanks again.
Thank you.